All right, guys. Quick video on the CAD paper. So obviously after class today, there was obviously a ton of confusion about the CAD paper. So I wrote a CAD paper. And I hope that in doing so, with this example that I have posted for you guys that I want you to follow, that this is going to basically quell any confusion about this assignment. Because ultimately what's posted here is what I want you to do. All right, so to be extremely clear, what is up here, what I put on Moodle is exactly what I want you to do for this paper. So what I'm going to do now is I'm going to go ahead and walk you through the example section by section, and I'm going to explain section by section exactly what I'm looking for. Okay, give me just 1 second. Okay, so let's go to Moodle first. Okay, so clearly, right, if you guys go into Moodle, you should be able to see this. You can. I hope you can see this. At the top of the class, okay, you'll see that I've posted a couple new things. Okay, the abstract guidelines are still the same. However, you'll notice that there is a new CAD paper posted. All right, the one that was up here, I looked over it again, and I decided that paper that I had posted today created too much confusion. So I put up a new paper that follows exactly the abstract, and exactly what I want you to do. So here's the new paper. Below that, you have the Center for Evidence-Based Medicine Levels of Evidence document that's going to assist you in grading the evidence that you find in your literature search. Okay, so let's get into the paper. All right, let me share that, and we'll walk through it section by section. Okay, here we go, guys. So let me just take you through this. Okay, critically appraised topic: shoulder stabilization methods and injury recurrence among those with Bankart lesions. Okay, so obviously I've got my abstract here. Okay, so obviously I've got the following sections here: clinical scenario. Okay, my clinical question, that's my PICO question. My data sources. Okay, best evidence recommendations, and we'll get into that more in the body of the paper. And then the clinical bottom line. Okay. So here's the deal. You have a limit on the abstract to no more than 450 words. Okay. I would be very surprised if you actually even approach that in your abstract, but that is your limit. Okay. A very handy way, by the way, to kind of know where you're at as far as word count is if you take your highlighter and you highlight kind of any area that you're curious about. If you look down in the far left corner of the screen, you're going to see a little highlight, a little area, and it's going to give you the number of words that's present in that highlighted section. Okay, it'll give you an accurate idea of your word count. Okay, let's start by talking about the clinical scenario. Okay, the clinical scenario section. What is this section? Okay, the clinical scenario section is where you lay out the clinical background, not only for your PICO question, but for your paper. So for example, my question had to do with different shoulder stabilization methods, at least as far as conservative treatment goes, on rehab, right? Or, when treating Bankart lesion conservatively. So in order to set the stage for my question, right? And in order to substantiate it and give it background for what I'm going to write about, right? I have to give background about what a Bankart lesion actually is. Okay, so I did that. Again, I gave my clinical scenario section by essentially stating my clinical background. How do Bankart lesions happen? So it says repeated subluxation and dislocations of the shoulder often result in damage to the glenoid labrum and other soft tissue structures, including the glenohumeral ligaments, right? And result in injury to the anterior inferior labrum is to the Bankart lesion, right? And I go about laying out my clinical scenario in this way. That is the background for my PICO question. Okay, now look at how I finished this section. Okay, I give a lot of detail in regards to, different kind of complications from Bankart lesions, specifically Hagel lesions, Gagel lesions, right? And I say, obviously talk about the fact that a lot of times, these are often treated surgically, right? However, the one thing that I say down here, and this is going to help me in a second, justify my question, my clinical question. Okay, now pay attention to this. Okay, we talk about, well, surgical repair is common. There's times where surgery may not be the best option for a patient. Okay, and in these cases, we may have to try to treat these conservatively, right? And so ultimately, in doing so, we're going to develop, there's a question that we develop, well, what type of exercise is best? Do we just look at scapular stabilization or really just rotator cuff strengthening? Okay, if you guys can't already tell, I clearly just made this question up for the sake of illustration. I wanted to make this as easy as possible, okay, to kind of show you what's supposed to go here, okay? Now, so given this information, right, I say at the very end here, however, there is currently no consensus as to which approach to stabilization is superior or perhaps more helpful for reduction of symptoms and instability events for the maximum, I said maximization for some reason, for the maximization of function while foregoing surgical intervention. In this critical appraisal, we will examine the two approaches to determine, being scapular stabilization versus traditional rotator cuff strengthening, to determine which is more beneficial in prevention of recurrence of subluxation or dislocation. There you go. Then we go right into our PICO question. Next section, clinical question. Here it is. In collegiate football players with a history of Bankart lesion who are not surgical candidates for whatever reason, right? Maybe it's just not a right time for them. Maybe they've only dislocated once and maybe they can be treated conservatively, right? Is scapular stabilization versus traditional rotator cuff strengthening more beneficial in prevention of recurrence of subluxation or dislocation? Okay, P, patient population. Who's my patient population? Collegiate football players with a history of Bankart lesion. Okay, I, my intervention. What's my intervention here? Scapular stabilization. Okay, my comparison. C, rotator cuff strengthening, right? And my outcome. Okay, recurrence of subluxation or dislocation. That's me. That's my outcome. Okay, so now I go into my data sources. Okay, and when you guys are gathering all your data for this, here's what I want you to do. Okay, so in this example, I say that I search the Cinehell, PubMed, and Cochrane databases. All right, and now I even give my search terms, even including my Boolean phrases: Bankart lesion and rehabilitation, scapular stabilization or rotator cuff strengthening, or Bankart lesion, right? And so I provide my search terms here, right? And okay, I total as I kind of delineate those search terms. I keep track of the number of articles that pop up initially. How many articles do I have initially? Well, I said I had 43 articles initially. Okay, but remember, okay, we have a very specific question, so we need to apply some inclusion and exclusion criteria to this question, right? And so, all right, exclusion. What are my exclusion criteria? All right, so the exclusion criteria, the exclusion criteria are anything discussing post-operative care, because we're not looking at surgical intervention here, right? And those which also concurrently discuss SLAP lesions. Okay, so those, if it discusses either of those two things, the paper is out. Okay, inclusion criteria, right? So include articles that discuss conservative treatment strategies. Okay, and even rehabilitation protocols, including strengthening exercises. Right, so I apply those to this initial number of papers, and after the inclusion and exclusion criteria are met, right, I have a total of 5 articles that have been narrowed down. Now, for this paper, you will only need a minimum of 3 and a maximum of 8, no more. Minimum of 3, maximum of 8. All right. So there you go. That's the data sources section. All right. Okay, best evidence. Okay, this is where, this requires probably the most detail, right? So the evidence was evaluated using the Oxford Centers for Evidence-Based Medicine criteria. They see the, So, okay, what I'm going to do now is I pulled up this PDF, and this is on Moodle for you guys. All right. So we have a level 1, okay, level 2, level 3, level 4, and level 5. All right. So here's the deal. All right. If we look at the type of evidence that is out there, right, in regards to this question, right, if we have a large number of systematic reviews with very clear inclusion and exclusion criteria surrounding the specific question, right? Something that's been studied before, right? Very likely that this could be a higher level of evidence, perhaps level 1, right? Okay, level 2. Also some systematic reviews, and or surveys, right? Now, ultimately, another thing that's really important though is that the key difference between level 1 and level 2 is that, okay, these are generally utilizing systematic reviews or meta-analyses, whereas at level 2, right, they're looking at actually, experimental studies with a reference standard. I can explain more of this in class, no problem doing that. Okay. All right. So, okay. So level 1, think systematic reviews. Level 2, okay, randomized controlled trials, right? Still primary studies. All right. Okay. And then, all right, level 3, obviously studies that don't include randomization, and ultimately like cohort studies or, or other types of studies. Okay, level 4 and level 5. Level 4 is essentially expert opinion, case series, case studies, right? And then obviously, level 5 is the lowest level of evidence, consisting of essentially just, conjecture, mechanism-based reasoning. Okay, we don't really understand why something happens, but we can assume this because generally we know that. That's called mechanism-based reasoning. Okay, so how do we take this, right, and apply this to our paper? Let's take a look. Okay, so what I've done here, okay, I just touch on here initially, why I excluded the articles that I excluded. Okay. And I say, okay, so many of the systematic reviews and randomized studies were often focused on surgical techniques or differences between techniques, right? So that ultimately tells me that the evidence here that I'm going to be utilizing is not level 1 because it wasn't based on systematic reviews. Okay. Now, additionally, right, there were also not any randomized studies either that looked at this question, right? So level 1, level 2 evidence may not be appropriate for categorizing the evidence, right? At least that I have here. Okay, now I do say that the evidence that I found consisted of case series and case studies. Ding, ding, ding. Okay, looks like we might have level 4 evidence present here, right? All right, so what I'm doing now, if you pay attention to this, okay, I'm actually going through the types of papers. So I had 2 case series. Case series is when you have a problem, a clinical problem like ACL injuries or concussion in a group of people. That is a case series. So what happens in a many number of patients over time. Okay, that's a case series. And so I talk about my case series first. Okay, so they examine conservative treatment strategies in people with Bankart lesions in a total of 27 patients. Okay, that's 1. I talk about those first. Okay, so they reported some short-term benefits for those undergoing conservative treatment for Bankart lesion. Okay, and I talk a little bit about the exercises there because I want to link this to my clinical question, right? So they did scapular stabilization exercises, obviously with an emphasis on retraction and depression. We did add in some rotator cuff strengthening exercises in some of these papers, right? Followed by closed chain stabilization, right? So, and I do say ultimately, no patients in these 2 case series were able to obtain long-term benefit from conservative treatment alone without the need for surgery. Okay. Okay. Those are my case series. Now, I've got 3 more papers though, because I found a total of 5, right? So 3 articles were individual case studies. Okay, and I kind of go through and I discuss each one a little bit. So the first paper, okay, one paper explored conservative treatment in a patient with a history of 1 dislocation. Okay, so it's that here they use scapular stabilization exercises and they use a little bit of closed chain strengthening exercises with a positive outcome. But I do say here that, it's noted, however, that this patient only had 1 dislocation, right? And so that very well could have contributed to the high level of success that he experienced with conservative care. And so it's very important to know the papers that you're citing and have read them, right? Have a good idea of what it is that they say, okay, so that you can critically analyze them and, really kind of make conclusions about why things may have happened the way they did, okay? All right, then my last case study here, right? So this is a bony Bankart lesion in a college football player, right? So ultimately consisted of traditional approaches, rotator cuff exercises mainly. Closed strain strengthening was not utilized in this case due to the presence of a bony Bankart, right, or a small non-displaced glenoid fragment. This guy probably had a little bit of a gaggle lesion, right, with a little bit of a bony avulsion there, right? Non-displaced though, but clearly it would not make sense to obviously have the patient in a weight-bearing position through that fracture segment. So the patient stayed open chain, right, not closed chain. Okay, so now this is where I actually come in and I rank my evidence. Okay, so I say here, due to the lack of systematic reviews, structured clinical trials, or randomized prospective cohort studies, right, examining this topic, the level of evidence currently available for this clinical question is rated at a level 4. Okay, so based on case series and case studies. Okay, and this is further substantiated by all available evidence located currently relegated to case series or single patient case reports. There you go. That's how I analyze my evidence. All right. Okay, then I give my clinical bottom line. Okay, so here we go. The clinical bottom line is where you concisely and succinctly summarize the evidence with a clinical take-home point, right, for the clinician. So here I say, athletic trainers attempting conservative treatments must make clinical decisions on a case-by-case basis when attempting to treat patients conservatively with a history of Bankart lesion. No difference or evidence of clear benefit has been found or reported in the literature for use of scapular stabilization alone versus rotator cuff strengthening alone in the treatment of this pathology. It's best to utilize a structured clinical approach that is tailored to the patient's clinical presentation, as well as one that is tolerated by the patient for the most advantageous clinical outcome. Clinical decisions regarding treatment should be based on a combination of patient history, clinical examination, and imaging findings to best determine appropriate restrictions and exercise selection. Okay, here we go. So what about the body of the paper? I've already told you guys that the abstract, maximum of 450 words. Okay, for the body, okay, minimum of 1,000 words, maximum of 2,000 words. Okay, there's your references here. Remember, minimum of 3, maximum of 8, right? There you go. References listed here. I give you a little bit of a, and as far as AMA goes, these are where your authors are listed: author, last name, first initials, title of the article, journal name is in italics, right? You're published, volume. If there's an issue attached to it, it's in parentheses, colon, page numbers. Here's an example of that in real life. Okay, Anderson GK, Smith JK, bony Bankart lesion in a college football player case report. You have the Journal of Shoulder Stuff. I made that up. Okay, volume 15, issue 3, pages 200 through 206. Okay. All right, guys, this is what a CAT paper is supposed to look like. Now, it's really important to note that with an athletic training, there is no standard format for a CAT paper. And I know that all that does is add to the confusion, but the point of this, right, is to really kind of help you guys develop an exercise as far as applying the evidence and utilizing the evidence to essentially create and learn the process for creating clinical best practices, right? Maybe you'll write something like this and publish it one day. Maybe you'll utilize something like this just in your own practice as an athletic trainer, okay? But the bottom line is that this is what it's supposed to look like. This is what I want, okay? And we'll discuss this more in class, but I wanted to post this for you guys. I wanted you to have this example at your disposal, all right? Hopefully this quells some of the stress and the confusion around this assignment, and I hope this helps, okay? Thanks.